Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments, such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org.
Giving Tuesday is all about celebrating generosity, and Boise State Public Radio needs your help in giving back. Nominate your favorite local nonprofit for a chance to win $1,000 in on-air messaging. Over the years, your response and enthusiasm has made this a special tradition and opportunity to lift up other organizations. Learn more and nominate your favorite nonprofit by visiting boisestatepublicradio.org before Tuesday, December 2nd.
From the studios of Boise State Public Radio News, I'm Gemma Caudette. This is Idaho Matters. 31 babies across the U.S. have now been hospitalized due to a botulism outbreak. In fact, the Idaho Department of Health and Welfare has confirmed that a baby from Ada County has been hospitalized with suspected botulism. Now, this is all potentially linked to By Heart Whole Nutrition infant formula. That formula is part of a nationwide recall. And although this is Idaho's only identified case, the product was available both online and in stores throughout Idaho. Dr. David Pate, who is the former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak, is joining us today to talk more about this. Hi, Dr. Pate.
Hi, Gemma.
So, Dr. Pate, this is scary. So for parents who may be hearing about this for the very first time, can you explain to us what botulism is and why it can be so dangerous? I mean, in particular, with these babies.
Right. So botulism is a disease that affects the nervous system caused by exposure to a toxin, which is produced by a bacteria. And so that bacterium called Clostridium botulinum, it makes spores. And then those spores are toxic, particularly to babies, because what usually happens, although this is a rare disease, why most people don't know much about it, is that typically in these settings, it's ingested by the baby. And it gets, the problem is babies don't have acid levels like we do, which older people, it tends to kill the bacteria. Plus, they don't have all the normal gut bacteria that we have that typically makes it much harder for that spore to develop and cause the toxin. But babies are very vulnerable. And that's why we tell parents, do not give your babies honey. Don't give them corn syrup, because those are also potential sources. But every once in and now again, that those spores and that bacteria can get into the food supply. In this case, it did. And so, as you said, we've had 31 infants. They range anywhere from 16 days old to 200 days old in 15 states. And ironically, I have a wonderful friend who first told me about this a couple of weeks ago, that his newborn was also exposed. So I've been praying for him every day. And fortunately, his child is still fine, but it is extremely scary.
Well, and the thing is too, Dr. Pate, is, so many times with formula, I mean, if you are a strictly formula-fed baby, I mean, I can't imagine how scary this is for parents right now. Both of my children were formula fed, and I can't imagine the type of fear that I would be in, even if I wasn't using this particular product. So, with that said, this case has been linked to By Heart's Whole Nutrition formula. There's an investigation going on right now. So do we know about how this contamination may have occurred? And really, I guess, how concerned should families be if they've used this product recently? Because it sounds like these infections have come from different batches of the formula.
That's right. So as far as the updates that I've received, it's been tied to two different lots. That makes me suspicious that there may be more of a problem at one or more of the processing plants. I'm not sure, and that investigation's still going on. They'll figure it out. So here's what I would say. First of all, this is exceedingly uncommon because the standards that companies use that make baby infant formulas and food
Hmm.
are pretty strict. So I don't think if your child wasn't receiving these products, I don't think that you need to be concerned. That would be this is an extremely rare occurrence, fortunately. Now, if your child was getting this particular product, the good news is it was recognized some time ago, and so most of that product is pulled. I think you wouldn't find it on the shelves now, so you don't have to worry about that. The big thing would be
Hmm.
to check and see if you have it in your home. If you have it in your home, that brand, and it turns out to be one of those lots, don't throw it out yet. Put it in a container and make sure that you label that container such that no one would use that. Put it away where children couldn't access it and keep it for 30 days. The reason is if your child does become ill, then the public health authorities may want to test it. And so that way you'll
Oh,
have it. But you generally develop botulism anywhere from 18 hours after ingesting it to 30 days, depending on how much
oh
you
my goodness.
ingested and your age and all those things. So there are a lot of different factors. But if it's been more than 30 days, then don't worry about it. And if you did put the formula aside, you may now dispose of it in the trash. But that is what I would do for now. The big thing is if your child received this formula, know what to look for. Usually the first sign is constipation, but remember, we're dealing with infants under the
Babies.
age of 1, babies, and so they're not going to tell you any symptoms. And most parents won't notice that the baby has stopped having bowel movements until days. So that's the first thing. But then look for the next signs, which will be more obvious. Probably the next thing you would notice is that it doesn't seem like your baby is sucking as well from the bottle,
Mm.
or if you are using a formula to supplement breastfeeding, that maybe the baby's not latching on as well, not sucking as hard, and then you might notice that the baby having episodes of choking. And any of those signs, especially if your baby had received that product, then I would alert your doctor. The next sign we would see is where some of their muscle strength is affected. They may have the baby may have trouble holding its head, or it seems floppy. Now you're getting to
Hmm.
where we're getting approaching an emergency situation. So just take the baby immediately to the hospital. The fortunate news, while this is a very fatal condition if not treated, I am thankful to God that all 31 of these infants are currently okay. They've been hospitalized, and we have a treatment for this. We give them something that we call Baby Big, and the Big is the acronym for botulism immune globulin, which just means that we vaccinate some adults for the bacteria, and take those adults that produce a lot of antibodies to it, and then we
Hmm.
refine those antibodies, and now we can administer them to babies after extensive testing to make sure they don't have anything that would put the baby at risk. So in all cases, so far that it appears that is working. Praise God.
So good treatment. So get that baby in quickly if you're starting to see those signs or symptoms, Dr. Pate. And what advice
Exactly.
do you give parents? And what advice do you give parents right now who, no matter what, they're going to feel anxious about this? I mean, I know I would if I still had babies, and knowing that I formula fed, like I said, even if you weren't using this product. But again, just, maybe, be aware, be vigilant, but maybe not so worried if they haven't used this particular product.
Well, that's right. If you haven't used this particular product, I would say you don't have anything to worry about. Now,
Okay.
the other situation where we see this is unfortunately there are health and wellness. Quote unquote experts, nutritional supplement sales folks, those kind of things. And maybe people, in fact, you can find them on social media. And you need to be alert that this is dangerous information. What they say is what you want to do is give your baby organic or natural honey to build their immune
Mm.
system. That is wrong. That is dangerous as part of this, kind of health fad thing where they're actually promoting something that sounds good, but honey is very potentially dangerous for infants. Please don't do that. Most of them are not pushing corn syrup, but that would be the other thing. It would be of some risk. But do not give an infant honey, no matter what the people on social media or these health promoters are telling you. Very dangerous.
All right. Now, a new study of nearly 30,000 women found a strong association between high consumption of ultra processed foods and an increased risk of developing colon polyps. That's the key early warning sign for colorectal cancer. Now, while the exact causes behind the rise in early onset cases still remain unclear, these findings are adding to growing concern about how our modern diets might actually be shaping long-term health. So, Dr. Pate, what exactly are ultra processed foods and why might they influence the development of early colon cancer?
Yeah. So, first of all, when we talk about unprocessed foods, the very, very most healthy foods, those are ones that occur in their natural state or they're barely altered. So when you go to the grocery store and you get fresh fruit or vegetables, that's not processed. So then the processing process that's awkward, but that the process is typically altering by adding sugar, adding oil, adding salt, and so that would be things that processed foods would be like cans of tuna, certain cheeses, things like that. Ultra processed is all of what we just talked about with processing, where they add sugar, oil, salt, those kind of things. But it's also the adding of artificial flavors, artificial colors, and preservatives that will increase the shelf life. And sometimes it's additional ingredients that preserve the texture of the food.
Mm.
And so these are going to typically be packaged foods, hot dogs, sodas, a lot of frozen dinners, deli meats, and packaged cookies, cakes. Those kinds of things are ultra processed.
So, Dr. Pate, the study found a 45% higher risk of, I believe, these polyps among the highest consumers. How significant is that from a clinical standpoint?
Yeah, this may be very significant because we have been trying to understand why we are seeing more colon cancer at a younger age. And certainly changes to the American diet could certainly be a potential contributor. And we are in a phase of medicine right now where we are having an explosion of knowledge that we had no idea about when I was in medical school about the
Hmm.
so-called gut microbiome, this mixture of all the bacteria that are in your colon and what processes that plays towards both health and disease. And it certainly appears that when you have higher amounts of ultra processed foods in your diet, it does change this microenvironment of your colon, your large intestine, the bacteria that are going to be in it, and that may affect your health. And that seems to be the case here with colon cancer. The What is good about colon cancer is we can generally even prevent it, because if you undergo screenings, what happens before, in most cases, that you would develop colon cancer, you would develop these polyps you were referring to called adenomas. And so when we go into for a colonoscopy, if we see those polyps, we can remove them. And if we remove them before they're cancerous, then you've actually prevented them from becoming colon cancer, which we believe if left in place for years, that would happen. It appears that these younger people may be developing these precancerous polyps earlier due to these changes in their diet, where so much more of our diet now is ultra processed. I don't think
Mm.
anyone believes this is the whole explanation, but this
Hmm.
is good because perhaps we can make a focus on improving diets, and that could improve our overall health as well as deter the growth of these adenomas and eventually cancers.
Well, one of the things I thought was interesting, Dr. Pate, is that the researchers adjusted for factors like weight and diabetes, even fiber intake. So, does that still tell us that there is an association with ultra processed foods?
Well, it makes it more likely because
Okay.
it is true that people that have a lot of ultra processed foods in their diet do tend to have higher caloric intakes, and therefore are more prone to gaining weight. And then, of course, with weight, there's also the association with diabetes. So what this tells us is that they can really kind of take out of the equation some of those other factors like obesity, like diabetes. And it's not
Mm.
that it doesn't seem as likely that ultra processed foods are causing that, which is then in turn causing the problem. It's really the fact that the ultra processed the ultra processed foods are so high in the diets that it is altering this state of the normal environment of the colon. Now, again, this is not proof. This is an association. It does make sense. It certainly could be a plausible explanation. We're not sure it's in the entire explanation. And we have to consider this was from the Nurses' Health Study. So it was, and this particular group, if I recall, it's been a while since I looked at this data, but I think it actually was all females. Now, there's no
Hmm.
reason I know of to think it would be different for men. But the other thing that was a bit unusual is that at the time they were doing this, the colon screening recommendations were still back at the time where we started at age 50. What they had in this study that they looked at is adults less than 50 who had had two colonoscopies. So that kind of raised my antennas. Wait, why would they have had that?
Hmm.
And it does make me wonder if there's a bias that some of these folks might have had perhaps family histories or other
History.
risk factors. So I'm not ready to hang my hat on this study, but what's important about this study, it is offering us a hypothesis. It is offering us a clue, and I do think that merits having more study. And further, we know for health benefits, it would be good if we counseled people to reduce ultra processed foods in their diet
Hmm.
anyway.
So, Dr. Payne, have they moved the recommendation to start a colonoscopy at 50 since we've seen more people getting colorectal cancer before 50?
Yes. So what happened was that recommendation was to start at age 50, but
Hmm.
then the American Cancer Society in 2018, because we were seeing some of these younger cases, moved that recommendation down to 45. Now, the American Cancer Society is very prestigious, and that was authoritative, but that doesn't determine reimbursement from payers and coverage by insurance. That's the USPSTF, which is the Preventative Task Force recommendations. They followed, but they didn't follow until 21, and they reduced it to 45. So now, if you have a ACA compliant plan, it is required to cover that at no cost starting at age 45, but that didn't happen until 2021.
Okay. Dr. Pate, before we wrap up, I have a question from a listener, Lisa, and she says, I am that really rare senior that never had chicken pox. I actually had a titer test that confirmed this. So, at my doctor's recommendation, I'm getting vaccinated for chicken pox. So, my question is, will I need to get vaccinated for shingles in the next year?
Well, it's a great question. The answer is yes. And so, chickenpox is the infection you get early in life, typically, where you break out in the rash. But zoster or shingles is the manifestation when you get older and that virus is reactivated. So, all adults over 50 should be getting the new shingles vaccine. We talked before, Gemma, that vaccine actually reduces your risk for dementia, but she should wait following the chickenpox vaccine and then get 2 doses of the shingles vaccine. And I generally recommend about 4 months apart, but yes, she'll still need it.
All right. Well, as always, Dr. Pate, we so appreciate you. We've been speaking with Dr. David Pate, former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak. And that'll do it for this episode of Idaho Matters. Thanks so much for listening. And just a reminder, you can find all of our episodes wherever you get your podcasts.
Over the river and through the woods to grandmother's house we go. The horses wait to carry the sleigh of wine and drift.
Gemma, isn't that a song from one of my very favorite Peanut specials?
Yeah, George, it is. It's from a Charlie Brown Thanksgiving. Now, remember, this is where the gang takes a trip to have Thanksgiving dinner with Charlie's grandma.
It's a lot like so many folks in Idaho who travel to see family during Thanksgiving or the Christmas holiday.
So, George, if you're traveling this holiday season around Idaho, keep your eyes open for possible stories for our Idaho 44 series.
That's right. You're gathering stories from all of Idaho's 44 counties.
Just remember, folks, if you're traveling over the holidays and maybe you see a story idea somewhere, send us a quick email. Just go to idahomatters@boisestate.edu.
And can it be any kind of story?
It can be anything.
So cool. Can I tell you, I just love Charlie Brown.
I mean, who doesn't, George?
Over the river and through the woods to grandmother's house we go. The horses wait to carry the sleigh of wine and drifting snow. Over the river and through the woods, oh how the wind does blow. It stings the toes and bites the nose. Over the ground we go.